This
Sounds good.
conference will now be recorded.
So we are off and running, and Ethan, I'll let you do the introductions and take it from there. Thank you.
Thank you. On behalf of the Department of Consumer and Business Services, Division of Financial Regulation, I'm Ethan Baldwin, and I welcome you to this public hearing to discuss the Division's preliminary rate decisions for 2021 health benefit plans. The Division holds hearings on all individual and small group rate filings. Each hearing is generally limited to discussion of the Division's preliminary decision and final objections regarding the filing. During this time, carriers will be permitted to defend their assumptions using information submitted in the filing or indicate agreement with the findings. Carriers may not introduce new information or propose new or revised assumptions at this time. When reviewing a rate request, Division actuaries consider such factors as recent and projected medical care and prescription drug costs, including any benefit changes, past and future loss ratios, that is how much of every premium dollar goes to pay healthcare claims costs. This is to ensure the requested rate is not projected to trigger federal rebates or payments from other federal programs. Division actuaries also review the recent history of rate changes and the overall financial strength, including profitability, investment income, and surplus of the company, as well as administrative costs. Division staff also ensure that the filings meet all requirements of the Affordable Care Act and determine whether or not the anticipated number of enrollees will adversely affect an insurer's financial position. You can review the full rate request for all the companies that have filed rate requests on our website, www.oregonhealthrates.org. All communication for every health insurance rate change filing, including written answers to all questions asked during the review period, are posted there as well. In this afternoon's hearing, we are discussing in this order the preliminary rate decisions the Division has made on individual and small group health benefit plans filed by Moda HealthPlan, Inc. and PacificSource Health Plans. Our agenda will be representatives from each company describe their rate requests. Then Division staff will lead a discussion about the Division's preliminary decision on each filing and the preliminary decision on each filing. Finally, we will accept public testimony. If you'd like to make a comment during the testimony time, just unmute, introduce yourself, and make your comment. Comments will also be accepted online through 11:59 p.m. on July 8th. The Division will make a final decision about these filings shortly after that public comment period ends on July 8th. So now we'll ask Moda to please begin by introducing themselves and explaining their rate requests.
Hi, my name is Ajmal Hasib. I'm the actuary working through the individual filings at Moda Health.
My name is Alex Vanos. I'm the actuary responsible for the small group rates.
I'm Mark Damberg-Wild. I'm the Director of Actuarial and Underwriting. Craig is having some difficulty with audio, but Craig Anderson, the Chief Actuary, is also on the line, as well as Tim Keller, the Manager of the Actuarial Services Unit.
Great, thank you. Please go ahead and introduce both filings at this time.
Thank you, Steve. So starting off with the individual filing. For individual, Moda requests an average rate increase of 4.7%. The range on this rate increase is between a 0.3 decrease and a 10.1 increase. And this rate filing impacts 42,631 members, which is our enrollment as of March 2020. Factors that have been revised since the previous filing, we've revised our area factors as well as our silver load. With our 2021 service area, so the plum regions here indicate where our beacon network is, while the aqua areas indicate where our affinity network is. The gray areas indicate where we will not be offering coverage in 2021. Changes for 2021 include that Marion and Polk counties, which are currently in Beacon County, will be switching over to the affinity network. And additionally, we will be leaving Deschutes County in 2021. In terms of our portfolio of plans for 2021, we're going to have 10 plans offered on the Beacon network, as well as 8 plans offered on the Affinity network. All of these plans will be offered on and off the exchange. With respect to new and discontinued plans, none of our 2020 plans will be discontinued in 2021. However, we will be adding new plans. These include a new Beacon plan as well as 5 additional Affinity plans. With respect to our current continuing plans from 20 to 21, this one details all of the changes that will be happening. And that's all the changes we request for our individual line of business. And now I'll turn it over to Alex to talk through small group.
So the average rate increase we're requesting for small group for 2021 is 5.8%. The minimum is a 1.1% decrease with a maximum of 18.5% increase. The members impacted by this rate filing is 5,890, and that is our small group enrollment as of March 2020. Factors revised since the previous filing. We made some changes in our area factors, and then also we updated trend and revised our quarterly increase. The quarterly increase we're using for 2021 is 1.6%. Our small group portfolio for 2021 consists of 30 plans. The breakdown is 5 platinum, 11 gold, 10 silver, and 4 bronze. Our small group portfolio uses 2 networks. Our Connexus network is available statewide, and then plans offered on the Synergy network, gold and silver plans are available statewide, and then platinum plans are only available in Area 1 in 2021. In terms of new and discontinued plans, we did not discontinue any plans in 2021. We are offering 3 new plans in 2021. So we added a gold high deductible health plan, as well as a $0 deductible platinum and gold plan. This slide calls out all the benefit changes that we made for 2021. A lot of these are to reflect the changing out-of-pocket and deductible limits that the federal government sets, and then also to meet updated federal AV calculator requirements.
Is that all?
Yes, and that concludes our rate filing.
Mark was going to speak to the, or I'll pause there.
All right, thank you. Division staff will now lead a discussion about the division's review of the filings and the preliminary decisions.
Hi, this is Kim Hinkle. I was the primary lead reviewer on these filings.
Michael Sink. I am the secondary reviewer on this filing.
Hey, my name is Tasha Sizemore. I'm the Life and Health Program Manager.
We also have TK Keene and Lou Savage. I think TK looks like he's on mute, so he might be talking to us right now. I'll just kind of go through, some of the things that we looked at when we reviewed the filing, and this will sound very similar talking about individual and small group because a lot of the elements are the same. But I'll start with the individual filing. So the first thing that we looked at was the trend, and we compared the trend that Moda filed not only with kind of their historical trends, but in addition compared to
Tim, I think you muted yourself on accident.
Wait. Or his phone dropped.
Michael, do we have you?
You do have me. I can pick up where he left off until he gets back in and joins us again. Yeah, caller 2, that was Tim. Okay, so we reviewed the trend. We compared the carrier's trend, not only with their historical trend, but their past pricing trend and the trends within the marketplace. We compare that trend with what we know is happening nationwide and within the state via various public reports.
Hello.
And then we put those together. Tim, are you back with
Hello.
us?
Can you hear me now?
We can hear you.
Okay, I don't know what happened. It just stopped. Anyways,
I just finished the trend bullet point.
Okay, great, thank you. We talked about trends. Thank you. Let's see. So we also considered risk adjustment and reinsurance, and also the starting point base period experience that Moda used on the individual filing. And initially we really had some questions about what Moda was doing in regards to kind of the membership that they expected to retain, and kind of how the mathematics worked on how the reinsurance, risk adjustment, and morbidity would all play together. But through the objection process, we were able to understand this, and we felt this was satisfied. And in addition, the reinsurance and risk adjustment was in line with what we would expect, especially in comparison to the rest of the market. We had no findings there. The company, also included, its administrative fees and taxes and margin, and in comparison again to the rest of the market, we had no concerns there. We felt that was sufficiently justified. In addition, we asked about the area factor changes, and the company, sufficiently justified its changes through the objection process. The company did include a COVID impact of about 1%, and we determined that this was not unreasonable, and it was not excessive. But we do want to follow up with the company, and when I'm all finished here, I think I'd like to turn it back over to the company to talk about any new data or assumptions that they might have regarding the impact to COVID-19. But ultimately, with the preliminary decision for the individual filing, we've determined that we would like to approve as filed. But there are some things that might change that. Any additional information that comes in regarding COVID, we'll certainly review it. And also, the final risk adjustment numbers for 2019 haven't come out, or well, if they have, I haven't seen them yet. And so we would like a chance to review those in comparison to what the company filed. So let me talk about the small group filing. It's more or less, kind of the same thing here. Is we compared a lot of these items to what the other carriers filed, and other knowns or unknowns in the case of COVID that would give us some sort of idea of what a reasonable range for these assumptions might be. And again, on the small group filing, there's not really much else to add. I just will say that our preliminary decision again is to approve as filed on the small group filing. I would like to just turn it back over to the company to see if they have any additional comments regarding COVID-19 and any new data or assumptions that are emerging, and how those might affect costs.
Okay. Thank you, Tim. This is Mark. I will be addressing the questions regarding COVID-19. So we have been monitoring the emerging data coming out of Oregon Health Authority on a very regular basis, tracking what's going on with COVID-19 in the state of Oregon. What we're seeing in that data is that it does look like since the end of May that really the growth curve for number of cases in the state has resumed growing at an exponential rate, although at a much slower rate than it was back in kind of the March-April timeframe prior to the shelter-in-place rules being imposed. That's obviously not sustainable. I mean, we're seeing things with about a 26-day doubling period right now, which would lead to kind of a catastrophic level of number of cases in the state by the end of the year. So obviously something is going to have to change between now and then, either a reimposition of shelter-in-place rules, perhaps at a county level, or stricter enforcement of mask regulations, or something along those lines is what we are kind of expecting to happen through the remainder of 2020. But we are not seeing any signs that the COVID-19 is going to necessarily cause a reduction in cases going forward the way that it did in kind of the March-April timeframe. Most of the professional services have been able to switch to telephonic for providing those services, and at least for now, the load for COVID-19 cases is not so much as to overwhelm the system. So there's not really a deterrent of elective procedures the way that there was in March and April. So we're expecting the costs associated with COVID-19 will continue to go up through the remainder of this year and really through 2021. The load that we put into the 2021 filing is very much assumption driven at this point, and it's very difficult to give better assumptions behind the numbers that we came up with. But I would note that the Society of Actuaries released today a report on the 2021 impact of COVID-19 for healthcare in the United States. And the number that we have in there is actually on the low side of what they're showing in some of the scenarios that they have modeled. I believe that they were showing adjustments of 2.5 to 4.5 or so, depending on the scenario, for how much sort of additional cost there would be associated with the disease in 2021. And the way that they approached it is fairly similar to how we did as well, of sort of making assumptions around, breaking out the cost of vaccination or treatment and hospitalization. So I feel like our methodology is relatively sound. Obviously, it's impossible to know at this point in time exactly what it will turn out to be, but I believe that our current COVID-19 load is appropriate and reasonable, and we would not like to adjust it at this point.
Okay, thank you very much. I think I'll pass it over to Ethan now.
Yes, thank you, Tim. Moda, any additional information or comments you'd like to make at this time?
I don't believe so.
Nothing from here.
Alex, anything?
Nothing from me.
Nope.
All right, then we'll.
Yeah, thank you very much for your review of the filing. We appreciate the dialogue and the work that went into the review. And that's it from us.
Thank you.
Thank you. Thank you. We'll go ahead and take any public testimony at this time. If you'd like to make a comment, please unmute and introduce yourself. All right, it seems no one signed up to testify at this time, so let me remind anyone listening that July 8th is the last day for public comments, and they can be submitted online at www.oregonhealthrates.org. We'll pause for just a moment, and then we'll hear from PacificSource. All right. PacificSource, please begin by introducing yourselves and explaining your rate requests.
Hi, this is Clara Combs. I'm the Director of Commercial Pricing representing PacificSource. I'm also joined on the line by our Chief Actuary, Mark Florian. So thank you for this opportunity to discuss our filings. I'll go over our high-level summary of each. In individual, we are requesting an average 4.2% increase. Rate increases will vary by plan, as low as a 3% decrease and up to a 6.2% increase. As of March 2020, we had about 28,000 members that are potentially impacted by this filing. However, with this filing, we are expanding our service area into Jackson, Josephine, and Douglas counties. We didn't offer products there for the last few years, and we're excited to enter those markets again. We do have two plans, our Smart Choice and Navigator Gold 1500 plans, which will have an additional added benefit of adult vision. Other than that, there are no product changes that would constitute a discontinuation. With this filing, we're requesting changes to our base rate relativities, and then we will be adding a geographic factor to cover the Southern Oregon counties. We are not making any changes to tobacco factors, age factors, or the geographic factors already in place. On our small group filing, we're requesting a 1.3% year-over-year increase. Increases in that filing will also vary by plan, from a 4.6 decrease to a 4.6 increase. And that filing will also include a 1.5 quarterly trend factor. In our small group block, we have about 11,000 members that are potentially impacted by the filing. In terms of plan changes, we have 4 plans: our Smart Choice, Navigator, Pathfinder, and Voyager Bronze HSA 5000 plans will be discontinued, and those will be mapped to another similar Bronze HSA plan in the same network. With this filing, we're requesting changes to base rates, relativities, as well as a slight decrease to our quarterly trend factor. And there will be no changes to our geographic factors, age factors, or tier factors. And then just a comment on both filings. We've had no changes on the filing since our original submission. And to kind of address COVID more directly, there's still a tremendous amount of uncertainty around the timing and cost of potential future treatments, vaccinations, other indirect costs such as pent-up demand, especially as we're projecting out to 2021. In our original filing, we elected not to load premiums for potential COVID expenses, and we're not requesting any changes to that approach.
Thank you. Division staff will now lead a discussion about the division's review of the filings and preliminary decisions.
Hello, my name is Tim Hinkle. I was the primary reviewer on this filing, or on these filings.
My name is Drew Bucks. I was the secondary reviewer.
My name is Tasha Sizemore, and I'm the Life and Health Program Manager for the division.
TK Keene, Deputy Administrator with the division. Lou Savage may be on. He was having some difficulties, the administrator with the division, some technical difficulties with the GoToMeeting. So I know he's trying to get on, and he might be joining us shortly here.
Well, I know what that's like. I'll get started talking about these two filings. But like we said, our preliminary decision is to approve both filings as filed. I'll briefly go through some of the items that we reviewed. I'll start with the individual filing, but the small group will sound very similar to that. On the individual filing, we reviewed the trend, and we looked at the company's historical trend and also compared the trend across all carriers. And we believe that the PacificSource trend used in both filings is within a reasonable range, and we propose to make no changes to it. The risk adjustment and reinsurance calculations we felt that the reinsurance calculation was sound. The calculation uses kind of the approach of how many dollars of funding are available rather than running it through a claims distribution. We felt that was an appropriate calculation. With the risk adjustment calculations, PacificSource chooses to make an adjustment to their experience period morbidity rather than project out a risk adjustment calculation. And per our product standards, we believe that's an appropriate way to handle the risk adjustment. Furthermore, we compared the historical risk adjustment and what we suspect it might be without the morbidity adjustment in their projected period, and found that compared to the market, it was a reasonable figure. Therefore, we proposed no changes to the risk adjustment or reinsurance. On the administrative costs, we found all these reasonable. We would like to point out that PacificSource has reduced their profit margin from last year. So I believe on the individual filing, you brought it down 2%, and on the small group filing, you brought it down 1%. We did ask about this, and the response was generally around the idea that you'd like to keep your plans affordable for members, especially during this uncertain times, and we did take note of that. So like I said, our preliminary decision on the individual filing is to approve as filed. On the small group filing, again, we felt trend, risk adjustment, and the change in margin was appropriate. And then, like you said, Clara, that you didn't include a load for the COVID-19 on either filing, and we have some carriers that did, some carriers that didn't. We felt that it was reasonable at this time to not include a load for the COVID-19. And you've already alluded to kind of going forward, at least for now, that you don't anticipate any changes to that load. We'll continue to monitor the situation, however. And one other thing is that the final risk adjustment numbers, hopefully, they'll come out sooner than later. But once those come in, we'll review those and see kind of how those numbers might influence any potential changes to your rate filing. Having said that, I think, like I said, on the small group filing, we will approve, our preliminary decision is to approve as filed. I think that's all I've got here. I suppose I'll pass it back over to Ethan.
Thank you, Tim. PacificSource, do you have any additional information or comments you'd like to make at this time?
No, thank you.
All right, we'll open it up to public testimony. If you'd like to make a comment, please unmute and introduce yourself. All right, it doesn't sound like we have anyone signed up to testify, so let me remind everyone listening that July 8th is the last day for public comments. They can be submitted through our website, www.oregonhealthrates.org. Thank you, and that concludes today's hearing.
Thank you.
Thank you, everyone.